Good afternoon. Thank you so much for joining us. Can you just introduce yourself for the audience?
Hi, my name is Dr. Sarah Hinkley. I am a professor of optometry at the Michigan College of Optometry at Ferris State University.
And you're here today to tell us a little bit about the paper that you are publishing with us. Can you tell us what was the reasoning behind it?
Yeah, so my fellow researchers and I decided to look at the association between attention deficit hyperactivity disorder, or ADHD, and accommodation. There's been a great deal of research on ADHD in relationship to oculomotor findings, to binocular vision findings, and a little bit on accommodation, but not nearly as much in that area as we would like to see. So we decided to dig a little bit deeper into that area.
So, in this study, what were your methods and how did you go about doing it?
So our study was revolving around the idea that we were going to use two design groups. Group one, which involved children who were not diagnosed with ADHD and did not have positive symptoms for ADHD based on a symptom survey, and group two, who were diagnosed with ADHD or did have positive symptoms on an ADHD symptom survey. Once we had the two groups established, we performed during clinical examination two tests on every child in addition to their regular eye exams. The test involved amplitude of accommodation testing and NOT or MEM retinoscopy for accommodative lag measurement. We then looked at the two groups, group 1 and 2, and determined whether or not there was a statistically significant effect on accommodation based on the diagnosis of ADHD by symptom or by previous diagnosis.
And what were the results of the study?
Yeah, so the results were fairly interesting. We didn't find a statistically significant link between amplitude of accommodation and ADHD diagnosis or positive symptoms. However, we did find a statistically significant link between having an abnormally low accommodative lag and the diagnosis of ADHD.
So, now that you have the results of the study, what is the take home message to the readers, and how do you think it changes, or what are the implications for practice?
Right. Well, we really have two pieces of information that can propel us forward in further research. One is that the rate of diagnosis of ADHD is actually quite low in at least our clinical population compared to the rate of diagnosis based on a symptom survey. In other words, there were many children who had a positive diagnosis of ADHD based on the symptom survey alone, but weren't previously diagnosed by their primary care provider or pediatrician. So that was very interesting. There's likely a very large undiagnosed population. The other interesting take home message is that the association between low accommodative lag and ADHD is quite revealing and maybe will lead to further research in that particular area. For instance, can clinicians who find a child with low accommodative lag perhaps recommend or further investigate the link in that child between ADHD symptoms. So that it needs further research, but this is a really interesting entryway into looking at that further.